moment to officially welcome Dr. Nata Menabde, the World Health Organization representative to India. Thank you, ma'am, for being here.
I think this is one of the rare occasions when we are talking about a subject that does not really come into the routine work of policymakers on a daily basis. But it is something which is having quite a significance in terms of influencing how the policymakers approach their work and how they make their decisions. And it's a very, very good opportunity actually to reflect on how not only we produce good quality research and relevant research, but also how are we going to be linking the policy-making process with the findings of this research and how we make this linkage a little more effective and efficient. And we are having very prominent participants of this panel who will share their views with us from the management perspective, from the global health lens also, but also from the academic institution perspective, and from linking this to the policy making. Now, before I start asking some of those questions that actually have been presented, I know even if I was not here, but I have seen the presentation, which would be putting some questions forward for the panel to discuss. And I wanted to actually emphasize two main issues as a driving for this discussion. One thing is that we do need to agree what the health system is, and we have to agree that we are dealing with health system. And system means that if something goes wrong here, it will affect something else. If something is done well here, it may affect the other parts. So system actually implies interrelationship between different parts of them. So it's not just components of the system, but it's also linkages and interrelation between this system. And when we are designing or thinking about research, I think it's very critical that we are not only thinking whether we should study primary health care provision or something else, but we should also see how is it going to influence, for example, universal health coverage, how is it going to influence access to care, how is it going to influence the clinical outcome of this treatment. And this is very frequently not taken into consideration. The other point is, how do we define the system? Let's face that in India we have very complex, and I'm so glad that Health Secretary is staying here with us, because we are having huge system, public system, which is both in the rural care and in tertiary and hospital level. But we are also having a bigger private system, and that private system ranges from very, simple care provision and perhaps less qualified provision, or we have also traditional system, which is also there playing a very important role, and it ranges up to 5-star hospitals. So I think we need to define what system we are talking about if we are serious about studying the system. And from WHO's perspective, and I'm not imposing that, but this is how we define it, we talk about ensemble of all institutions, public and private, who are actually involved in providing health services and looking at all other functions of the health system that are to improve health, be it health financing function, or be it the service provision function, or be it the governance and stewardship function, or be it generation of necessary resources, be it human resources or technologies or devices or medicines that are required for providing those services. So I think this is important questions to ask. The second focus that I thought would be good to hear the views of our panelists here is about what kind of research we are talking about. And that is again very important, because I believe that if we talk about research that is relevant for policy making, then it should be questions which are on the table of policymakers. And that questions largely can be answered through operational research, through the system research, through the organization of services research, and many other things. So maybe we should a little bit focus on some of those dimensions when we are talking about finding effective ways to bring the research towards the policy makers and make it more impactful on the outcomes and performance of the system, because I think ultimately research should enhance performance. So we need to be very clear how we define that, what do we measure, and again the example of polio, which has been so kindly brought by Health Secretary Ravindran, is a very good example. Everything what has been achieved was based on a very rigorous collection of data, looking at the data, looking what is going wrong. So this is only one part of research, of course, but there was a lot of innovation research in looking how do we reach these families, how do we vaccinate every child, how do we investigate cases, how do we define the case, and so many other things that have fallen on the ground there. And I was talking yesterday to a very big project which has now started about polio legacy, to see how the success of polio can be benefiting other public health programs, and a lot of this is happening already in India, in routine immunization and vaccine-preventable diseases at large, but also in terms of strengthening the system. And I was telling the researchers about actually the biggest probably legacy which polio has left in public health terms is that it created a culture of monitoring, evaluation, and making decisions on the basis of evidence which is collected through the routine implementation of the program. And I think those people who have been involved, who are now in various other places working, who left international organizations and moved into careers in the government places, these are the people who understand what they need to make a program success. So I think these are some of the very good lessons which we have even in India and even with the very particular programs, but there is of course a lot of relevant evidence available elsewhere, and I would start by posing some of those questions to our panelists and asking for their reflection on the questions that Dr. Sheikh has been putting forward earlier today, and some of the maybe points if they trigger any thoughts on your end. So maybe I'll start with Professor Kanjilal.